All right, what's up everyone? Dr. Dane and Dr. Emily here in the house. We are doing a video on how to hypervolt your friend, relative, spouse, partner, colleague. It doesn't matter who it is. Everybody's always looking for a helping hand, right? Dr. Emily is working on patients all day, and so we're gonna give her a little TLC, and we're gonna show you guys, if you do have your own Hypervolt at home, how to use it on your partner, your friend, anybody, it doesn't matter who it is, right? So, I like the Hyperice Hypervolt. This is one of the newer ones. It's got the pressure lights that light up that show you how much pressure you're using. I like setting 2 the most. That's my favorite. Setting 3 sometimes is a little overpowering for people. So, Dr. Emily is sitting on a bench. She can be sitting on a couch. She can be sitting in an office chair. It doesn't matter. Maybe she's got 5 minutes. You have 5 minutes. You say, hey, let's exchange 5 minutes of our time so we can help each other out. And that's always an awesome thing to do in life. The power of touch is incredible. The power of touch helps heal muscles. It helps to relax the body and take somebody that might be stressed or that might have neck tension and help them to chill out. One of our preferred methods of treatment is using the Hypervolt, okay? So, Dr. Emily's first gonna place her hands right on her thighs and just work on a little bit of lat engagement downward, which is gonna help to loosen up the neck muscles. And then we're gonna use this Hypervolt right around her scapular border, right? Which is kind of like right around here. And if you feel whoever's back you're working on, you'll feel the scapula, which is the shoulder, basically the big shoulder bone, right? And I always like to tell patients, clients, Dr. Emily also likes to recommend that for Christmas and what else? Birthday. Father's Day.
I got one for my dad.
Yeah?
Yeah.
What does he use it for? Himself or others?
My mom stole it. So.
Mom stole it. So, what you'll find, and here in the office, we like to recommend functional gifts for people. Gifts that are going to provide some kind of health improvement, right? And the Hypervolt is something that I love to recommend. And here in the office, we always say, buy a functional gift. Use a functional gift. Help somebody to achieve a better state or a better quality of life, right? And what, your dad, he's hard on his feet and his knees and everything?
Yeah, he works in a restaurant, owns a restaurant with my mom, on his feet all the time. He gets a lot of heel pain, plantar fasciitis, so he'll even use this on the bottom of his feet at times.
And that's it. People are hard on their bodies, right? And so many people, they might not ask for help because they don't know how to ask for help. They don't know what help is out there. And one thing that we like to use to help people, patients, family, loved ones, is the Hypervolt, because you can use this on yourself, and there are other videos on the YouTube channel where we have how to Hypervolt yourself. This is kind of like how to Hypervolt your partner, spouse, friend, colleague, doesn't matter who it is, your dad. He needs some TLC to his musculoskeletal system. We all need TLC, right? To our musculoskeletal system. Where would you say like most of your tension builds up, Dr. Emily?
In my traps and shoulders, I would say.
Go ahead, look down for me a little bit. So, and that's common for us. We're both chiropractors. We're working on clients all day. We're using our hands to grip. We're holding tools. Hopefully we're using them with good posture, holding down in the lats, but definitely day-to-day stressors just build up in the neck. So many people have headaches, migraines, chronic shoulder problems, neck problems, back problems. And so what we like to do here in the office is recommend that you and somebody else, if you can't reach your own neck, which nobody can, it's difficult, you can hit the upper portion, but you can't hit your mid-back, which really feels good. Exchange 10 minutes or 5 minutes of your time with somebody else's and give them a little TLC, a little musculoskeletal love, so that it's really going to brighten up their day, right? You're probably feeling good already just after 2 minutes.
Yeah.
And she'll leave work today and say, man, I actually feel a little better. So, how to Hypervolt your partner. 1, focus on the borders of the scapula, which is kind of like, again, from the middle of the spine around to the side. So many people have rotator cuff injuries, supraspinatus, and upper tract tension. which these are your upper trap muscles right up here. Can you lean your head to the right? And so, there you go, perfect. And so we're gonna have her stretch her neck out and feel that super tight band, which you just passively stretch. You probably feel that right there, right? And we're gonna kind of just get over on the top of that trap and just provide some therapeutic vibration therapy to help Dr. Emily get a little relief in her neck tension. And first posture is going to be this kind of like nice upright seated posture. And this is going to allow us to really focus on the upper shoulder girdle, up into the neck, and down into the scapula. And now what we're going to do, can you put your hands on the inside of your thighs? And you're actually going to round out pretty good. And now, so what we just did here was, she's kind of blocking her arms, which helps to get a little bit of lat and tricep activation. So you feel how you get a little tension right in here. And this is a great way, this is even a great stretch to just help decrease neck tension. But for us, it's going to open up her scapula. So position 2 is going to be that open scapula rounded back position. And she's going to hold here, and we're going to get deep into the ribs. And now her scapula is moved really far away from her spine. So this has actually stretched the muscles in the mid-back out. And she, I'm sure, is feeling some spots are ticklish, some spots are tender and sensitive. All spots need to be stimulated and worked out a little bit. Using the Hypervolt is really awesome because it instantly provides some relief, improved circulation, reduced muscle tension, improved range of motion. And we always pair this with our clients in the office. We always pair it with spinal adjustments as well as other exercises, corrective exercises to help reestablish core strength, proper postural engagement, lat activation, and back chain dominance, which you guys have seen in other videos. All right, now we're gonna kind of twist to the right a little bit and just really elevate that left shoulder just like that. And another great position, let's put this left hand, let's reach this over here like this and just kind of press right there. And now Dr. Emily's really opened up her left side thoracic region and rib cage, right? So now we can kind of get deep down under the scapula, and some of this is ticklish for people. And again, we can just use this gun to feel that she's got a little spot right here that we're going to work on, right? So we can follow the scapula, or we can come down the spine. Let's go back to center and just bend forward for me, right there. And I'm just going to keep my hand rested up on her upper back so she knows where I'm at, and I'm not out here like waving to people or doing anything else. We're focused as we use this important tool on her, and we're paying attention so that we can be efficient in our time and make sure that we're hitting the left side evenly and the right side. And we're going to ask our partner, whoever it is that we're working on, do you have any problem areas? Do you have neck tension? Do you have shoulder tension? If you do have any type of ongoing, long-lasting pain, you need to seek out the help of a professional, somebody that can help you to understand how to move better, number one, but also how to go through daily stretches and exercises so you can ultimately take care of your body yourself and never experience aches, pains, discomfort. And let's just lean to the left now and use, yeah, perfect. So we hit the left side, now we're gonna come over to the right side, and we can even switch hands and get right up and down the scapula. And then over, down on the thoracic spine, okay? Last position we're gonna do for the spine today, come back to center, and can you just go a little deeper so we can get down in the low back like that, perfect. And now we're gonna work on the erectors, and there's a lot of different positions for this. We call them the spinal erectors because they hold us upright, right? And so here we're just gonna work, again, kind of maintaining a little bit of hand contact with whoever it is that we're working on. Some of this might be a little ticklish down around the oblique region, and then over here. And we're just gonna kind of treat the erectors. Lean to the left a little bit. As she leans to the left, that helps open up this right side of her spine. And now lean over to the right a little bit. And sit back up. All right? All right, so that was a great, simple video. I think it was probably about, I don't know, 8 or 10 minutes long. And that's a perfect time, right? We're all busy throughout the day. Everybody has 10 minutes to give to somebody else. Hypervolt's a great tool to have at home on your coffee table.
I think one question I get a lot is how much pressure do you use when you're pushing into someone? A lot of times people will take these home and use them on their partner and they're just like jamming it into their back. You really just need the weight of the machine, and you can add a little bit more pressure depending on what they're comfortable with. But
perfect. Yeah, definitely don't jam it in, right? It's better to, and that's such an awesome point, is that you don't want to jam it in so that your whole body is like shaking, but just light pressure is much more effective than heavy pressure. Cool?
Yeah.
All right, guys. If you have any tips for future videos, shoot us an email or comment below, and we'll see you guys on future videos.